Good evening, everybody. Thank you very much for joining us. When the pandemic began, we had little knowledge of this virus and none about the vaccines and the treatments we have today. So there was no option but to use government regulations to protect our NHS and save lives. But those restrictions on our liberties have brought grave costs to our economy, our society, and the chances of our children. So from the outset, we were clear that we must chart a course back towards normality as rapidly as possible by developing the vaccines and treatments that could gradually replace those restrictions. And as a result of possibly the greatest national effort in our peacetime history, that is exactly what we have done. Thanks to our brilliant scientists, thanks to the extraordinary men and women of our NHS, and to every one of you who has come forward to get jabbed and get boosted, the United Kingdom has become the first country in the world to administer an approved vaccine and the fastest major European nation to roll out both the vaccines and the booster to half our population. We've emerged from the teeth of the pandemic before many others, retaining one of the most open economies and societies in Europe, the fastest growth in the G7 last year. And while the pandemic is not over, we have passed the peak of the Omicron wave, with cases falling and hospitalisations in England now fewer than 10,000 and still falling. And so now we have the chance to complete that transition back towards normality, while maintaining the contingencies to respond to a resurgence or a new variant. As we have done throughout the past 2 years, we'll continue to work with the devolved administrations as they decide how to take forward their own plans. In England, we will remove all remaining domestic restrictions in law. From this Thursday, it will no longer be law to self-isolate if you test positive, and so we will also end the provision of self-isolation support payments, although statutory sick pay can still be claimed for a further month. If you're a fully vaccinated close contact or under 18, you will no longer be asked to test daily for 7 days. And if you're a close contact who is not fully vaccinated, you will no longer be required to self-isolate. Until April the 1st, we will still advise you to stay at home if you test positive, but after that, we will encourage people with COVID and with COVID symptoms to exercise personal responsibility, just as we encourage people who may have flu to be considerate towards others. It's only because levels of immunity are so high and deaths are now, if anything, below where you would normally expect for this time of year that we can lift these restrictions. And it's only because we know Omicron is less severe that testing for Omicron on the colossal scale that we have been doing is now much less valuable in preventing serious illness. We should be proud that the UK established the biggest testing programme per person of any large country in the world, but its budget in the last financial year was bigger than that of the Home Office, and it cost the testing programme cost £2 billion just last month alone. So we must scale back and prioritise our resources for the most vulnerable. From today, staff and students in most education and childcare settings will no longer be asked to undertake twice weekly asymptomatic testing. And from the 1st of April, we will end free symptomatic and asymptomatic testing for the general public. But we will continue providing free symptomatic tests to those at the highest risk from COVID. And in line with the practice of many other countries, we're working with retailers to ensure you will always be able to buy a test. We should be clear that the pandemic is not over, and there may be significant resurgences. Our scientists are certain that there will be new variants, and it is very possible that those will be worse than Omicron. So we will continue to protect the most vulnerable with targeted vaccinations and treatments, and we've bought enough doses of vaccine to anticipate a wide range of possible JCVI recommendations. Today, this includes a new spring booster which will be offered to those aged 75 and over, older care home residents, and those over 12 who are immunosuppressed. we will also retain disease surveillance systems and contingency measures, which can ensure our resilience in the face of future waves or new variants. And we will build on the innovations that defined the very best of our response to the pandemic, including continuing the work of the Vaccines Task Force, which has already secured contracts with manufacturers trialling new vaccines which could provide protection against new variants. Today is not the day we can declare victory over COVID because this virus is not going away. But it is the day when all the efforts of the last 2 years finally enabled us to protect ourselves whilst restoring our liberties in full. And after 2 of the darkest, grimmest years in our peacetime history, I do believe this is a moment of pride for our nation and a source of hope for all that we can achieve in the years to come. Thank you very much. I think Patrick's going to do Chris can share some slides. Thank you.
Thank you, Prime Minister. First slide, please. The first slides are ones which have been shown before but updated. So the first slide is the number of people testing positive for COVID in the UK. And as you can see, although the Omicron wave is now going down, it reached an extraordinarily high peak, and the number of people still with Omicron is still very high, and people, including elderly and vulnerable people, are still being infected. Next slide, please. The number of people in hospital with COVID in the UK is again still significant, and this is still in many hospitals providing quite a lot of pressure on NHS services, but the rates are now going down and have been going down steadily now for some weeks. I think it's important to acknowledge that as with the last peak, and in this peak, it would have been considerably higher had people not listened to advice and been careful not to transmit to other people where it was avoidable, in particularly to protect vulnerable people. So this is, I just wanted to say this would have been a lot worse without that. But this peak was significant in hospitalisations, and those who say that this is a trivial disease, I think need to look at how many people were in hospital and still are going into hospital with Omicron. Next slide, please. On the other hand, fortunately, the number of people who have died with a positive test for Omicron, and of course some of these will not have died of Omicron, but many have, was much smaller than the previous peak, although every death is a tragedy for the individual and for the families. This is now steadily going down. Next slide, please. And as a result of the extraordinary work of the NHS, volunteers and people coming forward, we had a very rapid increase in boosting, which the fact that people were able to take precautions before and around Christmas time bought time for the boosting of the population, and in particular the boosting of the elderly and vulnerable population. This is continuing. People are still coming forward for their first, second and booster vaccinations, but that extraordinary upswing saved many people from going to hospital and will have saved also many lives. Next slide, please. I just wanted to make a couple of comments on the impact of vaccination on severity. There is no doubt that even with Omicron, which is a less severe variant in the vaccinated, being vaccinated significantly reduces in every age band the risk of going into hospitalisation, into hospital. And this is shown on this graph here. And if you look around the world at countries where Omicron waves are ongoing, and where elderly populations have lower vaccination rates, the rate of hospitalisation is substantially higher. Next slide, please. I think even more striking is what happens when we get into the most severe patients who go into in intensive care, ICU. And what this graph shows, going up to the age of 70, after that the data becomes slightly less easy to interpret because of confounding factors. But what you can see is the purple bars are the people, is the proportions relative to the population who are unvaccinated, and the very low bars there that you can see almost invisible are the proportions relative to the population in people who are vaccinated with a first, second or booster dose, demonstrating really clearly that you can be hospitalised, you can go to ICU, but that vaccination is a very substantial protection. Next slide, please. I'd finally like to just make a couple of comments on the relative importance of Omicron as a cause of mortality at the moment. And the first way of showing this is looking all the way back to the beginning of the pandemic. And this is showing weekly registered deaths. This is all deaths. This is not just COVID deaths. And in orange are the ones where COVID is mentioned on the death certificate. And what you can see is really big peaks, which occurred in the first and second waves, and a prolonged but much lower peak in the Delta wave due to vaccination. And then you still have people who are dying with COVID at the moment, but the dotted line, the purple line, is the average number of people you would expect to be dying at this time of year. And as you can see, the total number of deaths now, if you combine Omicron and everything else, is now slightly lower than the average seasonal average you would expect at this time of year. And to show this a slightly different, and before I pass on actually, just to point out, very large numbers of people, much higher proportion, are dying of other things. And that is a key part of the considerations for how we need to think about the next 9 months. Last slide, please. And this is a slightly different way of showing the same data. And what it shows is the really extraordinarily large waves of excess mortality. This is for all causes that coincided with the first, second and Delta waves, but actually a relatively small impact. In fact, in absolute terms, a slight decrease relative to the average for this time of year over the years that preceded the COVID pandemic. So I thought it was just worth highlighting that, because this does demonstrate that in a highly vaccinated population, with Omicron, which is a less severe variant than previous ones, the impact on overall all-cause mortality has been much more muted, in fact, essentially not visible compared to the previous waves. Now, I thought because there are some changes now, I'd just like to make some additional kind of forward views about what's going to happen, and then Patrick is going to add a few as well. The first is just to say something about the Omicron wave. The Omicron wave is still high. And if you look around the UK, we're still in places, we're still between 1 in 20 and 1 in 25 people have got Omicron if they were tested, according to ONS data, which are slightly backward looking. Now, the rates are coming down, but this is still a very common infection. And it is important to view the next period when we will still have testing all the way up to April, and which changes are happening, in fact, in steps. People think about this as one big step. This is a gradual, steady change over a period of time as the rates are going down and as we head into spring. And I think it's important to understand that context. This is not a sudden, everything stops. This is a steady move. The next thing it's important to acknowledge is that we all expect, and Patrick will talk more about this, there to be new variants. And some of those new variants will just disappear, but some of them will cause us significant problems, and they could be either more vaccine escaping, but as severe as Omicron, but the net effect would be actually more people end up in hospital because a lot of our protections are from vaccination, or it could be more intrinsically severe because Omicron came from a much earlier variant, and Patrick will talk a bit more about this. So we could certainly end up with something which is more likely to lead to hospitalizations than Omicron, and therefore we need to be very careful, as the Prime Minister said, and have both our surveillance and our ability to ramp up with us. And then finally, just as the good news is things are going down as we head into spring, we do have to accept that the respiratory season next winter and in subsequent winters is likely to combine COVID, whatever variants are circulating there, flu and all the other respiratory problems. So we expect the winters to be tricky even in the absence of significant new variants. And again, the vaccination programme that JCVI will consider will take that into account. And the implications of this are, as we look at the next weeks, we still have high rates of Omicron, and I would urge people in terms of public health advice, and this is very much the government's position, that people should still, if they have COVID, try to prevent other people getting it, and that means self-isolating. So that is the public health advice. It would have been the public health advice and will be the public health advice for multiple other diseases. If you had norovirus, we would give exactly the same public health advice. So this is standard public health advice for a significant and highly transmissible infection. All the things that people have done so well and have thought about so systematically remain important. Maximising ventilation, hand washing, and for the period when there are still significant numbers of cases, at least using masks in enclosed spaces with large numbers of other people is a sensible way of helping to reduce the risk to others. As rates go down, the relative benefit of these kind of things will change. But at this point, while the rates are very high, this remains sensible, pragmatic advice, which everybody knows about and everybody can continue to follow. And this is part of the steady movement towards a new phase of managing this virus. And we must have three things. We must have good surveillance, as the Prime Minister said, to ensure that when new variants start to take off, or when we start to see new surges, we know where they are and we can respond in a targeted and rapid way to make sure we deal with them before they cause significant problems for individuals and for the NHS. We must have the capacity rapidly to step up in terms of what we're doing, and we must be able to protect the most vulnerable. And those really are the critical things that we need to maintain even beyond this next few weeks into the rest of this year and the rest of the way that we continue to manage this epidemic. Patrick was going to expand a bit on the issues in particular around variation.
Yeah, thank you. So, very clear, this pandemic is not over, and it's carrying on around the world, and we're not out of it here yet. The virus is continuing to evolve. So, every variant is an evolution, and the virus has got a lot of room to evolve. And it will continue to do so quite fast, probably for the next couple of years. Those changes will alter the properties of the virus. There is no guarantee that the next variant is as reduced severity as Omicron. It could be the same, it could be more, it could be less. So as it evolves, what it's trying to do is transmit more readily, to grow. So that could be because it has got intrinsic transmissibility advantage, or it escapes immunity. And the change in severity is a random byproduct. So we expect there to be further variants, and they could be more severe. As Chris has said, if you look at Omicron, actually, with the immunity we've got in the population, the level of severe illness and death has been dramatically reduced. And that's the reason across the world people are beginning to release measures. It's not just here, everyone is beginning to release measures. But in order to do that safely, there are some things that need to be in place. The first is, it's absolutely essential to have a way of detecting it, a good surveillance system. And we're lucky that we have a very good surveillance system in this country, the ONS study, which is a way of picking up across the population, both at a national level and at a regional level and in different age groups, what is happening, and that detection system is going to be vital. The second thing that's important is being able to respond quickly. So the resilience and the ability to ramp up is absolutely crucial. And that doesn't mean ramp up over months. If something goes wrong, you need to be able to ramp up very quickly. Just remember how quickly Omicron took off. That tells you you've got a couple of weeks to get things back in action. So once you take things off, it's going to be important to know how quickly you can put them back on again and to get them back in shape in time to be able to deal with it. And the third is, throughout all of that, there's a sections of the population who remain vulnerable at all times, and it's important that they are protected, both in terms of their ability to detect the illness, the ability to get antiviral treatments quickly, and of course the protection that everyone gets from vaccination. So detect, respond, and protect the most vulnerable is absolutely crucial during a period of reducing the measures that are in place and being careful about how that goes in relation to what is an evolving virus with a period of quite unstable evolution over the next year or more. These measures are going to be important to give the safety net. And as an American colleague put it at the weekend, he said, you can celebrate when the sun's shining, but take your umbrella with you. And I think that's really the message.
Good. I think that sums it up very well. Thank you very much. Let's go to questions from the public first. Nicole from the West Midlands.
Looking at the data, it would appear that COVID-19 hospitalisations are currently at a similar level to what we saw in October 2020, just before we entered a second lockdown. Should we now be putting in place more measures to protect the NHS?
Well, thanks, Nicole. I'm going to ask Chris and Patrick to have a go at that as well. But I will just say that the big difference between then and now, Nicole, is that the number of hospitalisations is on a clear downward trend, and the number of people in ICU is as a proportion of those going into hospital is much smaller, and you'll have seen the fatality numbers that we're seeing, which are very different from what we experienced under previous waves. So it's clear that Omicron is very different and milder in the way that it behaves. And that's one of the reasons, in addition to the vaccines that we have, the high level of vaccine-induced and other immunity. That's one of the reasons we can do what we're doing. But Chris,
I mean, I completely agree with obviously the Prime Minister's answer. I mean, I think the three things to acknowledge. The first of which is it is certainly the case that there are hospitals in the UK which are still under significant pressure as a result of Omicron, and I think we should be really clear about that. But, and this is the big difference, the first big difference, the trajectory is definitely down at the moment, and it is steadily down and has been for some time. A way to go, but that is the direction of travel, very different to where we found ourselves in previous periods. And secondly, the proportion of those people who, having entered hospital, then end up in intensive care or getting into deep trouble and in some cases sadly dying is a very much smaller proportion as a result of vaccination, which we didn't have in October 2020, and of a less severe variant.
Thanks. Gemma from Greater London.
As a pregnant woman, I'm told by the NHS website that I'm more likely to suffer a serious illness if I catch COVID, and in the third trimester it could also affect my baby. With the plans to remove COVID restrictions being brought forward, what are the recommendations for women like me and for other clinically vulnerable people? For the sake of removing social distancing and wearing masks, are we effectively being told to stay inside and remove ourselves from the world?
Gemma, no, and I think that what everybody needs to do is make sure that they treat people who may be vulnerable in any way with the utmost consideration, and you know we've got to if we're symptomatic with any disease, you should treat vulnerable people with courtesy and avoid spreading it. What we also want to make sure is that people who are clinically vulnerable do continue to have access to tests so that they can know whether they may have COVID and also get the therapeutics that they need depending on what their condition is. But
could I just add one point, Prime Minister, which is it is really clear now that vaccination in pregnancy is a very good thing to do for you, a very good thing to do for your unborn baby, and new data demonstrating that it's actually also a very good thing to do for your newborn baby. There is now data that shows that it provides protection for newborns. So essentially it's protecting both you and your baby, and I would really want to use the opportunity, Gemma, of your question to encourage anybody who is pregnant and has not been vaccinated, please to do so.
Yeah, that is a very good point, because I think there was a while when there was quite a lot of folklore against vaccination for pregnant women, and that was really not right at all. Thanks very much. Laura Koonsberg, BBC News.
Thank you, Prime Minister. You are scrapping free tests for all, but you're telling everybody they have to take personal responsibility. How can people take personal responsibility if they may not be able to afford to get a COVID test, even if they're trying to? And do you accept that you're giving Scotland, Northern Ireland and Wales really no choice but to do the same, because there won't be additional money for testing? And to Sir Chris and Sir Patrick, You know, many times you've talked about how a lack of testing early on hampered the attempts to save lives. Now there are enough tests, but the government is no longer going to fund free tests for all. I know you've both emphasised the need for good surveillance, but testing is being scaled back. Do you worry that in time that could prove to be a mistake? And just forgive me, Prime Minister, as you've been speaking, President Putin has been talking. Could you respond to his claim to recognise the two separatist breakaway republics?
Yes, sure. So thanks, Laura. Look, on testing, the only reason, and first of all, let's be clear, we're not ending free lateral flow tests now. There are several more weeks still to go. We won't do it until the beginning of April. We can only do that because of the reasons that Chris and Patrick have set out: the high level of immunity, the relative mildness of Omicron, the low level of numbers of people in ICU, and the low mortality we're seeing. So that's the reason we can address Omicron in this way. But what we will do is make sure that there will be people who continue to get testing. Vulnerable people will continue to have access to testing and to free tests. But the most important thing is that, and I hope this is the big takeout from this, it's the sun is shining, but we're keeping our umbrella, as Patrick said at the end of this, at the end of his remarks. We were going to make sure that we invest in surveillance, and the ONS survey it really is world class. It's admired around the world. It gives a lot of very granular data about where cases are breaking out, patterns across the UK. We will keep that going. We will keep observing what is happening because we want to have the keenest pair of eyes in the crow's nest to watch for the iceberg in the form of a new variant, and that's the thing. That's the thing we've really got to test for, and the big surveillance tests are the way to do that. And if we see something like that, then that's the moment to get to Patrick's point. That's the moment when we ramp up, and we immediately go back to all the things that we have learnt to do. So we'll have a stockpile of LFDs, of lateral flow tests. We can make at least some of them already in this country. We have labs that will keep going, like the Rosalind Franklin lab, mobile testing units, and so on. So what we want is to have a formula of surveillance followed by surge if necessary. But we can only take the strategy, only adopt the strategy we're adopting today, because of the success of the vaccines and the way Omicron is currently responding. And sorry, on Ukraine, I just to say, I gathered just as I came into this press conference that Vladimir Putin has effectively announced that Russia is recognizing the breakaway republics of Donetsk and Lugansk. This is plainly in breach of international law. It's a violation, a flagrant violation of the sovereignty and integrity of Ukraine. It is a repudiation of the Minsk process and the Minsk agreements, and I think it's a very ill omen and a very dark sign. And it certainly does not seem to me that it's certainly an indication, yet another indication, that things are moving in the wrong direction in Ukraine. The UK will continue to do everything we can to stand by the people of Ukraine with a very robust package of sanctions, as you know, fortifying the eastern flank of NATO in all the ways that we have, but also being one of the few countries to have given the Ukrainians the defensive, I stress defensive, weaponry that we think is appropriate to their needs. And we will continue to think about what more we can do to support Ukraine in what is clearly a very, very dark and difficult time. I know there was a question for.
In terms of on the testing, the There are essentially three reasons for testing. There's surveillance, and I think the intention, as the Prime Minister has said, is to continue surveillance. There will be some modification to that, but the aim is to have a good surveillance system because you need that for policy decisions. The second reason is clinical, to guide treatment. Expectations continue that in the NHS. There are questions about exactly how we do this in terms of getting antivirals to the people who most need them, and that's a key decision that needs to be taken over the next period. And then the third reason, and this is the one that is being scaled back, but not yet, but will be scaled back, is using them for control. But as the Prime Minister said, as and when the surveillance shows you need it, what everybody has stressed is there's the need to be able to stand things up again if necessary, were there to be something that's severe enough to need it. So it's that third area where the biggest changes will really occur.
I mean, I don't think anywhere across the world where restrictions are being relaxed, you can have any other view other than that will increase transmission. So that is inevitable as you go back to normal life, that transmission risk increases. At the beginning, we just didn't have tests. We've now got tests, and fortunately we've got lateral flow tests which can be stored and released very quickly. And so it's going to really have to be this rapid detection and response at scale in order to get testing into the right place, depending on what the circumstances are. And as Chris has indicated, at the moment with Omicron, I mean, it's spread very widely. It hasn't caused huge numbers. It has caused some, and it has in other countries caused quite a lot. But in this country, it hasn't caused huge numbers of very ill people or deaths. If that changes, then obviously testing becomes more important. In the meantime, the testing must be there for people who need it. And that definition of people who are in that at-risk group is critical for appropriate use of testing.
Thanks. Robert Peston, ITV.
A couple of questions. On Ukraine, the recognition of Lugansk and Donetsk is a clear violation of international law, as you say. It's accelerating the breakup of Ukraine. Surely this is the moment to introduce additional severe sanctions. The time for waiting must be past. And on what you've announced today, a couple of questions. One is, after April the 1st, if you get COVID, will you isolate? Secondly, you announced today the end of the self-isolation support package, and within a few weeks you won't be able to get statutory sick pay on day one. You are making it harder for poorer people to do what you think is the right thing, which is to isolate if they get COVID.
So, fine, thanks, Robert, very much. So, on the statutory sick pay issue, first of all, and we will continue with the day one payments for the next few weeks. But I think after that, what we need to recognise is that we're effectively dealing with particularly in vaccinated people, with a disease that is like norovirus or flu or any other infectious respiratory disease, and people should think about how they interact with others, and they should be respectful of other people's health and behave responsibly. And that goes for any. That point I'm trying to make is that goes for any infectious disease which you might be bringing into contact with people who are vulnerable. I think in this country, I've often heard it said over the last couple of years that we have a habit of going back to work or going into work when we're not well, and people contrast that with Germany, for instance, where I'm told they're much more disciplined about not going to work if you're sick, and I'm just suggesting that might be something we could learn. And as for me, I will exercise restraint and responsibility and try to avoid infecting other people. And on your point about sanctions, look, we have to see what exactly has happened in Donetsk and Lugansk in the Donbass area. What I have said before about the package of sanctions is that they will be triggered with the first toe cap of a Russian incursion or Russian invasion. But plainly, what has happened is extremely bad news, and we will be urgently talking to our friends and allies around the world, all of whom are jointly signed up with us in this package of sanctions, because it is. I mean, I think the drift of your question is right. It is becoming clear that we're going to need to start applying as much pressure as we possibly can, because it is hard to see how this situation improves. Let's go to Beth Rigby of Sky.
Thank you. Prime Minister, just to follow up on Ukraine, 10 days ago at NATO, I asked you if you were coming to the conclusion that President Putin actually wants this war. At the time you said, I honestly don't think a decision has been made. What do you think tonight? How has that changed? And on the matter of COVID, Prime Minister, you've spoken about hope tonight and the country getting its confidence back. But to Sir Patrick and Sir Chris, it seems to me that you're making it clear that this pandemic is far from over. What are you feeling? Are you more anxious than confident as these restrictions are dropped? And to the Prime Minister, we've been doing these press conferences now on COVID for 2 years. COVID has dominated your premiership. It put you in hospital. It could bring about your downfall depending on the outcome of that Met investigation. And today it seems that you're trying to turn the page. But would you be satisfied if your legacy ends up being COVID and your conduct during it? Thank you.
So first of all, on your question about COVID, and I think Chris and Patrick may want to talk about anxiety. Look, I think that the country as a whole, when you look at the response to that the government was able to mount to COVID, and you look at what the country has done, I think the two things have gone together, and I think it's been quite remarkable. And if you look at the numbers at the back of the Living with COVID document about vaccination rates, rollouts, what we've been able to do, we were incredibly fast, and that was a joint work of the British public and the government. The public were absolutely heroic in what they did, and I will be very, very proud of what has been achieved, to be frank with you. But on the anxiety point, I don't want you to think that there's some, division between the gung-ho politicians and the cautious, anxious scientists, much though it may suit everybody to say so. We have a very clear view of this. This has not gone away. We're able to make these changes now because of the vaccines and the high level of immunity and all the other considerations about Omicron that you've seen. But we have to face the fact that there could be, likely will be, another variant that will cause us trouble. But I believe that thanks to a lot of the stuff that we've done, particularly investment in vaccines and vaccine technology and therapeutics, we'll be in a far better position to tackle that new variant when it comes. And on your question about Putin, and I don't know what's in his mind. I can't read it. I think there's still a chance that he could row back from this, and we've got to pray that that's the case.
In terms of anxious or confident, and I come from a profession which tries to train you not to be either of those things and to go between the middle and just have a plan and be steady about it, say these are the facts, this is the plan, this is what we're going to do, we will execute the plan, and we hope that we can go steadily in the right direction. So that's very much the way I hope that we can think about this and present this, so neither of the extremes.
So, I mean, just to quote again the same American I quoted earlier on, he said this weekend, the one thing that this virus has taught you is not to be cocky.
Yeah.
So I think we just need to go very carefully. We need to monitor carefully and be prepared to react. And the other thing that I think is clear, which is important to bear in mind throughout, and we said this right the way at the beginning, this virus feeds off inequality and it drives inequality, and that needs to be borne in mind at all times during this.
It does. Martin Brown, The Express.
Thank you, Prime Minister. You've spent much of the last 2 years urging people to work from home to help the fight against COVID. As we move into this next phase, and with the economic recovery in mind, what is your message to those people who are still reluctant to return to their workplace? And what more should employers be doing to get their staff back?
Well, thanks very much, Martin. Look, I've always been a believer in the importance of people getting into work, particularly for younger people who need to build up social capital and understanding of their jobs, their professions, and their place of work. And I think it is invaluable. I think if people try to do everything remotely, they will miss stuff out. And so I would encourage people. They will lose out, and I would encourage people to get back to work with confidence. I think we have the right now, we have the grounds now to be confident, and we should be confident. I think that was it, wasn't it? Thank you. Brilliant. Thank you. Thanks, Martin. Dan Bloom, The Mirror.
Thank you, Prime Minister. You've just talked about asking people to exercise personal responsibility, even to break the habit of going into work when you're sick, but you're also scrapping day one statutory sick pay, the £500 payments. So just to be clear, are you saying that a low-wage worker who has COVID should stay at home even if they're not going to get paid? And can you look people who voted for you in the eyes and tell them that that is an acceptable situation? And to the scientists, Sir Chris and Sir Patrick, two quick questions. Will you both continue taking lateral flow tests beyond April if you're going to a crowded gathering like the pub or something like that? And are you satisfied that the plan announced today will not lead to a rise in long COVID and will keep immunosuppressed people safe enough? Thanks.
Thanks very much, Dan. Well, look, we want to make sure that, and I echo what Patrick just said just now about the inequalities of COVID, and that's why we've done everything that we can throughout the pandemic to support people on low incomes who've been having it tough, with huge investments in hardship funds, increasing the living wage, all the contributions that we've made, and what we're doing now to tackle the cost of living. We totally get how difficult it has been. I think that it is still sensible for people to avoid spreading COVID and indeed any other dangerous respiratory disease. And I just go back to what I was saying earlier on. I think maybe we can learn something about the advantages of not spreading disease. Statutory sick pay is there, and also, of course, many people are entitled to other forms of pay. I know that won't be everybody, Dan, I understand that. But for those people who don't get enough support, we're trying to make sure that they get it in other ways, and they get helped in tough times through other support we're giving through local councils or by other routes.
In terms of the current situation, I mean, I'd like the prevalence to be lower, the rates of infections to be lower, and the SAGE advice, it's all in the public domain, shows that roughly somewhere between 20 and 40% reduction in transmission because of our current behaviours. So we're not back to pre-pandemic behaviours yet. And as those return, you would expect the pressure on transmission to increase. So there's something about cautious behaviour which remains. There's definitely the public health advice on isolation if you are positive with COVID. And I want to just re-emphasise the value of vaccination. And the long COVID point, there's now evidence that the vaccines don't just protect against infection and against severe disease, but they also reduce long COVID. So there's a very, very strong reason for everybody to be vaccinated. Get up to first dose, second dose and third dose. And of course, for the immunosuppressed, it's going to be, or the people who are particularly vulnerable, they may need another vaccine at some point to get that up, and they need access to antivirals, and they do need the access to testing in order to be in a position to be treated quickly. So I think there's a series of things that need to happen to keep everybody safe during what is inevitable, which is the world at some point needs to start returning to normal behaviours.
Will you carry on taking them even if you have to pay?
Sorry, go on.
Why don't I do that one? Because I completely agree, obviously, with Patrick's other comments. And I think there are three things that I would be trying to think about. First question is, how common is COVID at the moment? If it's very high, absolutely, that increases the probability. Second is the environment you're in. If you're in an environment where you're outside, a long way from other people, then the risks are so small it probably makes no difference. If you're in a crowded environment, absolutely. And the third, and probably the most important one, and it builds on what Patrick's just said, is if I'm mixing with vulnerable people. If I was going to see an elderly relative, if I was going to go to a let's say, haematology ward in a hospital, of course, those are the kind of situations I would want to minimise the risk to other people, because the whole point about the lateral flow is about minimising the risk to other people.
Thanks very much. Kevin Schofield, HuffPost.
Thanks, Prime Minister. Are you not simply adding to the cost of living crisis from April the 1st? People are looking at higher national insurance payments, higher energy bills, rising inflation, rising interest rates, and from April the 1st they're now going to have to pay probably about 20 quid for a box of lateral flow tests. Is that not simply adding to the cost of living crisis that people are already experiencing? And you talk about personal responsibility and people having to take on more personal responsibility now. Isn't that slightly hypocritical when you're under investigation from the police for allegedly breaking your own lockdown rules? And to the scientists, public messaging has been very important throughout the pandemic. Tonight you've said that the pandemic isn't over and that future variants could be more serious than what we've seen previously. But at the same time, self-isolation rules are ending and we're getting rid of free tests. Is there not a danger that we're sending mixed messages to the public and they might simply just switch off?
Kevin, first of all, so I can't comment on the allegations that you refer to. As I've said before, we'll have to wait and see on that. But I think the point remains very, very important, that we're moving away from legal compulsion to personal responsibility. But on your point about cost of living, and just go back to where we were, this change in the testing regime won't come through for a few weeks to come, by which time we hope and expect that the incidence will have further declined. So I hope that the impact on people will be minimal. But what we're also trying to do is abate that, deal with the cost of living crisis in the most important possible way, and that's with helping people with universal credit, with lifting the living wage, but above all, getting them back into work with better paid jobs, and by the way, which would not have been possible if we hadn't had the openings up we had in the summer, and if we hadn't been able to keep going throughout Christmas and New Year. And it's that strength of the economy that is the single best protection for people, the single best thing that we can do as a government to help them tackle the cost of living, and that is of course being made possible by the vaccine rollout and the way people are pulled together.
I mean, public messaging is important, obviously. It's much more difficult, practically, as someone who's trying to do it, when there's a transition than when you're giving the same message day in, day out. So, we have to accept that we're going through a transition, an appropriate transition, and that does mean we need to change the way we think about things, and that needs to be communicated as clearly as we can, and we do our best to do so. We don't always succeed perfectly. But I would make sort of a general point on the point about mandation, which is an issue absolutely for politicians and Parliament, and public health advice. They are separate things. There are very few areas of public health which we give advice on, which actually are subject to mandation. So that is a very atypical situation. What's happening is, in a sense, this is reverting away from an abnormal situation to a much more normal one. That doesn't mean the public health advice actually changes in terms of what, in broad principles, we think people should do, and I'm not going to repeat them, I said them right at the beginning. But I think it is important that people realise this is a steady change. This is not a sudden move. Of course, you announce changes at particular points in time, but actually what the Prime Minister has laid out is essentially a stepped series of things and the ability to keep looking at things so that if there's a change in the environment, then we can at that point respond to that change.
And I would just refer you to some of the SAGE papers released last week that looked at this question about consistency of messaging and the point that now it's health professionals, NHS, Chief Medical Officer, local directors of public health. That's where the clear, consistent messaging is going to come from, as Chris said, which is the advice that comes in rather than legal mandation. But that needs to be clear and consistent and aligned with overall government messaging, as you say.
Thank you, everybody, very much. I'm just going to go and talk to President Zelensky of Ukraine and offer him the support of the United Kingdom. Thank you.